Hi, folks. My name is Robert Ochoa. I'm the Director of Cybersecurity here at A&M. And today with me, I have Troy Baietto. And Troy is one of our top practitioners around the healthcare vertical space. And so we're going to talk a little bit about cybersecurity, how that relates to the healthcare specific market. It's a very unique market. Obviously, you have things like individually identifiable healthcare information. There's a lot of governance and compliance, and it's just really a unique space. So today we're going to be asking Troy a few questions around that space. Troy, welcome. How are you?
Good. Thanks for having me. Happy to answer some questions.
Fantastic. So the first one is why would someone want to cyber attack a hospital specifically?
Yeah. So, I mean, the fact is attacking a hospital or a healthcare network is severe when it comes to consequences. It's for this reason that the FBI and Department of Justice now classify cybercrime against these types of organizations a threat to life crime. So unless it's state-sponsored, most of these types of attacks are those of opportunity, not spite. So they're not trying to hurt anybody. They just want some money. The first opportunity is data breach and exfiltration. The price of a medical record on the dark web is the highest of any other typical breach record. So a single social security number is worth $1. Credit card information is worth a little over $100, but a single medical record can go between $250 and $1,000. And you can imagine how many medical records from throughout the existence of a healthcare system is in their system. So obviously there's a financial motivation for these threat actors. The second opportunity is regarding ransomware. Healthcare is the third largest growth target for ransomware attacks. It is becoming a huge problem. Ransomware is when you lock or deny access to healthcare data till ransom is paid. And the average cost of a ransomware attack for a healthcare provider is $9.2 million. Healthcare has strict retention requirements. The data is very much real time, so it's difficult to have offline backups that can't be accessed if a breach occurred. In addition to that, the result of a disruption of IT systems can lead to a huge impact on patient care and outcomes. Lives are at stake, so quick restoration is required. And the bad guys know that. So without time to restore data and systems, many hospitals and healthcare providers feel no other option than to pay those ransoms. And so that's what we're seeing a lot of motivation for going after healthcare systems is just the inability to operate without that data and the crucial nature of the work that they do.
Thanks, Troy. Pretty thought out. Ransomware continues to be a huge problem, and healthcare's definitely no different. There are so many risks in everything we do, in every vertical across the industry, across cybersecurity. How would you classify, and what are the major risks that are specific to healthcare? Why is that unique?
Yeah, that's a good question. Healthcare is usually a unique and challenging environment for cybersecurity and IT professionals. One of the big risks is third-party infrastructure that's embedded within the IT systems of a hospital. A tomotherapy system, for example, could include a whole rack of servers and control endpoints that the hospital doesn't control. And because of these systems are close to patient care and not managed by the hospital systems, they're a likely target. In fact, last year, 46% of ransomware attacks came from these third-party system breaches. Along with those third-party systems, there's plenty of systems on hospital network that utilize antiquated operating systems. There's nothing worse than calling a tech out to work on a broken mobile X-ray machine and watching them as they terminal into the underlying Windows XP operating system. Almost 96% of hospitals report that they have end-of-life operating systems on devices within their network. No other industry reports numbers like those, and much of it is in response to the FDA regulations on medical devices. Those medical device manufacturers have to go through that FDA regulations in order to update their systems. So the other unique risk is the need to reduce barriers to care. In an emergency room scenario, the patient can't wait for an ER doctor to check the MFA app on their cell phone before unlocking patient data for medication and history information that could guide their decisions. So the data has to be very much real time, And you can't put barriers in the way of those clinicians that would make them more secure, like multi-factor authentication. While those zero trust principles must be implemented, they can't impede access like other industries can forgive. So as we've worked with healthcare customers, we've also come along across a surprising number of security exceptions. The top neurology surgeon might hate resetting their password every 3 months, so maybe they just allow his password never to expire. As attackers continuously scout for targets, they know that security around those executives could be lacking. So we see them targeted a lot.
Thanks, Troy. Very, very thoughtful answer. So the next one, I'm going to talk to you a little bit about being new to cybersecurity, being new to healthcare. So I think it's no secret that just generally across the industry, we have what I think the industry's kind of coined now as a negative unemployment situation or a deficit. The demand far outweighs the supply of cybersecurity professionals. And so that healthcare is definitely no exception. So if I'm a cybersecurity professional that is new to cybersecurity and specifically new to healthcare, what resources do I have out there? Where would I start?
Yeah, Robert, that's a great question. We've seen obviously the market. It's hard for healthcare organizations to retain really good cybersecurity talent, and so a lot of times we see cybersecurity professionals that are new to healthcare. At A&M, we're always advocating to start with the industry best practices. So the NIST security framework is a great starting point for any security official. Beyond that, the Cybersecurity and Infrastructure Security Agency, or CISA, has a great resource for critical infrastructure protection, which they consider healthcare a part of. So the CISA website actually has that critical infrastructure section, and they have a lot of great healthcare resources. So understanding that and those frameworks around zero trust and disaster recovery methodologies are paramount for protection and allowing patient care to continue if an attack occurs. One of the best healthcare specific places to keep an eye on is a task force created by the Department of Health and Human Services known as 405D. So they have a couple of insightful cornerstone documentations. The biggest one is HICCUP, or Health Industry Cybersecurity Practices. HICCUP does a great job of breaking down the biggest 5 risks to healthcare and the mitigation techniques to lessen those risks. We talked about some of them earlier in this video, like ransomware, connected medical devices, but the documentation goes further into 10 cybersecurity practices like asset management, identity, oversight, and governance. And it's also great because they break it into 2 parts, one for small healthcare practitioners and another one for large healthcare systems. So HICCUP is probably the best place if you're already familiar with NIST and CISA and things like that. HICCUP is probably the best place to kind of look at what's unique about healthcare and what challenges are you most likely to face in that environment.
Very good, Troy. Thank you. Appreciate that. So a lot of activity around healthcare, spinning off that last question. So simply put, what can be done?
Yeah, so that's a long answer, but I'll try to sum it up as best I can. I think one of the advantages of working in healthcare is that the employees are typically motivated by the feeling of purpose and the emotion that comes with working and caring for patients. And so as A&M interacts with healthcare customers, we've seen the best outcomes when those providers tie patient safety and protection to data security, right? So getting everybody kind of rowing in the same direction and making sure that everyone understands that data security and cybersecurity is everyone's job is the best place to start. There's a lot of basic things that should be implemented from an IT perspective. We talk about them in our Zero Trust and Continuity of Operations workshop that we put on at A&M for our customers, but doing things like multi-factor authorization, email security, immutable backups, even something as simple as regular checks of the care continuity plans as required by the Joint Commissions, those are great places to start. We've seen almost 90% of healthcare organizations doing vulnerability assessments, yet when asked about advanced penetration testing, red team, purple team, that number drops all the way down to 20%. So obviously it's one thing to look at your vulnerabilities. It's another thing to test them. So that's another big place that we like to guide our customers. A large number of our customers are struggling to understand what devices are even on their network. And that is especially true in healthcare. We talked about third-party devices and antiquated operating systems. And if you don't know what's on your network, you can't protect them. So we've seen a lot of success creating bridges between information technology, cybersecurity, facilities, and biomedical teams. And that can go a long way in creating that kind of visibility, which allows then you look at segmentation and isolation technologies. So making sure that the IT professionals understand what kind of clinical devices are on their network and how they work is something that's paramount. So at the end of it, it's about giving your a call to your A&M representative. Ask them how we can help navigate the complexities of cybersecurity in healthcare. As a middle-aged man, it's only a matter of time before I do something only a younger person should be doing and need care myself. So that's definitely motivating me to ensure my healthcare customers are protected.
There's some truth in that, Troy. Well, thank you very much. We appreciate your insight as not only a network and security practitioner, but someone who specializes in the healthcare space. Thanks again for your time, and I hope you have a great day.
Thanks, Robert.